The night before your lumbar disc replacement surgery, I would try and get a good night's rest. After midnight that night, nothing to eat or drink. If you do have medications that are required to be taken, it's okay to take them with a small sip of water. That won't interfere with the anesthesia. Another thing I remind patients of is constipation is very common after a lumbar disc replacement surgery. So in general, I'd avoid eating anything really heavy a day or two before the surgery in preparation. For your lumbar disc replacement surgery, usually this is done on an outpatient basis, and it's a 23-hour stay. So in other words, patients will come in, have surgery that day. We'll generally keep them overnight that night and make sure everything is going well, and then you can go home the next morning. You will have some soreness both in the front area where the incision is, as well as in the muscles of the lower back. And so I would take the muscle relaxer that's prescribed, as well as use lots of ice. And if that's not sufficient, then the narcotic pain medication we prescribe can also be used.